Hello everyone, I am Dr. Rupali Sahoo, currently practicing as an assistant professor under the Government of Odisha. So in today's video, we will be discussing about a very common scalp disorder which everyone must have experienced during their lifetime. So what is that? That is dandruff. In this video, we will be discussing about very frequently asked question and which is required by many of our patients, even me when I was not a dermatologist. So these questions are, so number 1 is what exactly is dandruff? Number 2, what causes dandruff? Number 3, is it contagious or not? Number 4, how to manage dandruff? And number 5 is how to prevent dandruff. Let's come to our first question, that is what is dandruff? So dandruff is a very common scalp disorder when there is dryness of scalp which is associated with yellowish to whitish flaky scales and it is associated with itching. It is noticed that there is variation according to the season and it is seen that it is aggravated more in winter. Now come to the next question, that is what causes dandruff. So the etiologies are various kind. First we got to know that there is microbial association, that is Malassezia group of yeast. There will be fungal overgrowth of this yeast and that lead to dandruff. Other causes of dandruff are when there is dry scalp, when there is excess exposure to sun, that causes exfoliation of the skin over the scalp, that lead to dandruff. And when there is mild irritation over the scalp due to excessive use of hair cosmetics, use of heating tools, that leads to dandruff. And also over shampooing, over combing of hair, and when there is exposure to dirt and exposure to pollution, that also leads to dandruff. The third question by the patients are, is it contagious? No, actually it is not. Many of us think that I got it from my friend, but this is not true. So it is not contagious, it is only the overgrowth of your own commensal, that is Malassezia. So it is actually not contagious from others. So it doesn't spread from others. The question number 4, that is how to manage a case of dandruff. So if you are having dandruff, as there is association of fungus Malassezia for dandruff, so we should first give a patient anti-dandruff saboo. So what are the formulation we can use as anti-dandruff saboo while you are buying the shampoo? So these are ketoconazole, cyclopyroxolamine, zinc pyrithrone, selenium sulphide, coal tar and salicylic acid. So while buying a shampoo from a medical store, you need to keep all this formulation in your mind. So though we are visiting nearby medical store and buying all of them blindly, but it is always recommended that you should consult your dermatologist before buying any drug, and because hair is very precious for everyone, and also when there is inflammation, we are giving them steroid which act as its anti-proliferative and anti-inflammatory property. And next, in resistant cases, we are giving isotretinoin to them. So what are the 5 do's? Number 1 is we need to wash our hair very frequently. If we are having overexposure to heat, overexposure to dirt, then we need to wash it every alternate day, or if not, then we can wash it at least twice a week. Number 2, we need to wash with properly prescribed or medicated antifungal shampoo, as we know that Malassezia or yeast overgrowth is one of the cause. So we need to wash it with antifungal shampoo that I have mentioned already earlier. Then next is gentle massage. So we need to gentle massage our hair with all this antifungal shampoo. Then after that we need to keep it for at least 5 to 10 minutes before washing it off. So then fourth one is we need to have a proper healthy diet. So last of all, skin is the reflection of our stress-free and a balanced lifestyle and a balanced diet. So we need to include all the healthy diet. Now coming to 3 don'ts of our prevention. First one is you should not scratch your hair, because when there is more scratching, that will lead to more inflammation and that will land up in seborrheic dermatitis, and sometimes it may be very difficult to treat your hair condition. Next one is we should not use more of heating products. Third one is you should not overexpose your hair. So while you are overexposed to sun, so while you are going out, you should use a wide brim hat or it will cover your hair with your scroll or anything like that. Lastly, I would like to say that before using any of your dermatological product, randomly going to the medical shop and buying it, you should definitely visit to a dermatologist and you should use all the dermatological recommended products. So I hope this video will be very helpful for you. Thank you all for your very patient hearing.